Hi everyone, thank you for joining us today. Dr. Sabira and I are going to talk about
Hello.
Alzheimer, how to prevent it. And go ahead, Doctor. So tell us about Alzheimer's disease. What's the
Yes,
definition?
right. So Alzheimer's disease is, as we know, it's pretty common, especially in Americans, and we've had
It
one
is
of
this.
the
It is the
one of the
sixth leading cause of death in
six leading
U.S.
cause of death,
Yeah.
and it's up until now. If you ask conventional wisdom, there's still no treatment. Though there's drugs like memantine and then the cholinesterase inhibitor Aricept. But basically, it's the definition. It's there's a global impairment of mental function of these people, and one of the earliest sign of having this problem is memory, and it's basically on the pathology. It's usually the pathognomonic we call it in medical parlance is there will be a neurofibrillary tangles and beta amyloid plaques that accumulate in the brain. Initially, we thought that that was the cause of it, but based on recent research now, it is actually a brain protective mechanism from a secondary event, and that's where we're gonna talk of what's the root cause of this problem.
Yeah, because the key is prevention. You don't want to get there. As we know now, a high percentage of 65 years old and higher in US is 5.8 million people 65 and higher have Alzheimer's.
Right.
And the percentage becomes higher as we get older. So the goal is to prevent it. So that's what we're gonna talk about. Like for example, why is it like women have twice the risk, like two women compared to one man? I mean, why? It's because one of the reason we think it is, studies has shown, is because sudden hormonal drop, estrogen drop. As we know, hormones like estrogen or in men testosterone, it plays a key role in our memory. So that can affect other hormones like thyroid, like our adrenal, progesterone, all are the key point. But after age 50, our hormones start to drop. So we need to make sure our hormones are balanced. And
Another thing if they can add there is there is a genetic preponderance for you to develop Alzheimer's disease, which is the ApoE gene. So they said that if you have one out of two ApoE gene, you have risk of developing Alzheimer's of about 30%. But then if you have two out of two of these ApoE gene, it will be 50 to 90% depending on what studies you look at. But again,
yeah,
as we know in functional medicine, genes, okay,
it's not our destiny.
is not our destiny.
So,
So
yeah.
it will always be triggered by an environment, which is, I like the saying, gene loads the gun and it's the environment that pulls the trigger.
Exactly, that's very true. So I say epigenetic,
Right.
environmental factor changing our genes. So even if I have the double ApoE gene, APO4, the E4, so doesn't mean I'm gonna get Alzheimer because of my lifestyle, because I make sure my hormones are right. I make sure I do exercise. Why is exercise important? It increases the blood circulation to our brain. So when you increase the blood circulation or when you engage in mental activity, your brain produces synapses. It produces pathways that, as Dr. Asabiro talked about, this amyloid protein that cluster and can deposit come between your synapses, but you more synapse you produce, you have trillion of synapses in your brain, you less affected, you're gonna be you're gonna be less symptomatic. So you could develop Alzheimer from early on. You could start developing this plaque in your brain from age 40, 50s. You could build them up. But that doesn't mean right away you're going to be symptomatic. So it may take 10 years before patient becomes symptomatic. That's why I think genetically we want to know if we are predisposed to, if we have the APO4 gene. If you have that genetic gene, then you could be more proactive. You want to do at least 20 minutes of cardio 3 times. Cardio meaning jogging 20 minutes 3 times a week, or you could do brisk walking. You don't have to be jogging, you could do brisk walking, but then you want to do 40 minutes 5 times a week. So exercise increases the blood flow to the brain. And then what else? What other factor? Go ahead.
Nutrition, really important. So we now know that Alzheimer's is diabetes type 3, right?
True.
And basically it's what we call insulin resistance. So here's an interesting research that I've read about it. So what that means is, as long as you eat sugary stuff, processed food, which increases your glucose, that's when your insulin starts to go up, trying to drive down the glucose back to normal level. And there is an enzyme called insulin degrading enzyme that works to degrade the insulin. So once the glucose is inside your cell, the insulin needs to be degraded, right? So that insulin degrading enzyme will work on that to degrade the insulin. It's what's interesting to know that this enzyme actually also degrades the amyloid plaque in Alzheimer's disease. But then if you continue eating high sugary stuff, then that enzyme is busy degrading the insulin instead of the amyloid plaque. So then the amyloid plaque continues to build up over time.
Yeah, and also this protein buildup, when your hemoglobin A1C is greater than 5.2, greater than 5.2, it can affect your brain. You could deposit this protein sugar, glucose protein complexes in the brain, which can increase dementia and other.
Right, and I explain it to my patients like, caramel, and then it binds to the proteins, it becomes sticky. So that's basically what it is.
Yeah. So
that's one of the things that we need to do is to watch our diet right away, low glycemic.
So saturated fat, like bacon fat, saturated fat, trans fat, these are not good for you. You want to do Mediterranean diet. There's a lot of studies out there for Alzheimer and dementia. Mediterranean diet is the best because it has 10 servings of fruit and vegetables. You eat a couple times a week fish. These are all good. And dairy product is not the best. If you have the gene, you want to avoid dairy product. You want to avoid saturated fat and consume a lot of colorful vegetable and fruits.
Right.
They're full of antioxidant, like blueberry, like raspberry, pomegranate. You want to eat cabbage. You want to eat cruciferous vegetable. These all have good nutrients. Not only do they prevent Alzheimer, they also prevent cancer, prevent other chronic diseases. So this lifestyle that we are recommending right now in terms of preventing Alzheimer and dementia, it really helps with cancer, other chronic diseases as well.
Right. One of the things that I would add as far as causes of dementia, and when you look at other articles in it, they found actually in Alzheimer's disease, they found bacteria in the brain that's causing this inflammation. And one of those common bacteria that they isolated is bacteria coming from the mouth. And it's really important that we need to clean and see a biologic dentist that can help you with that. They saw what they call Porphyromonas gingivalis, one of the bacteria that they saw. So that's one cause.
Also metals.
Metal toxicity.
Metal toxicity, aluminum.
Mercury.
Now the studies shows they've seen aluminum in people with Alzheimer's. That was autopsying the brain. They saw aluminum metal deposit, and we know how mercury is such a neurotoxic too. All the metals. So you want to make sure you don't have metals in your mouth, and then make sure you don't consume too much metals by, like for example, eating too much shrimp. You get cadmium. You get mercury by eating fish. You want to make sure you limit your fish intake to 2, but still twice a week. But then also you want to make sure you check your metals, see you don't have too much of it because they accumulate in our bone and tissue. Sometimes just doing a blood work is not the best way to go. So usually on my Alzheimer or dementia patients or people who want to prevent it, I make sure I do provocative testing or I do a urine testing for metals. And then as we discuss hormone, nutrition, exercise, one of the key one is the sleep. Sleep plays a key role. And sleep deprivation can link to, as a lot of you guys experience, when you don't sleep well for a week, your memory goes down.
Brain fog.
You get that brain fog and short-term memory is down. So we all know sleep does affect our memory.
And one of the things that we learn a lot in integrative functional medicine is leaky gut. So there is a brain gut connection, as most of you probably have heard about that. So anything that causes inflammation in the gut actually would also lead to inflammation of the brain. So that's really important that we need to look at. As integrative and functional doctors, we look at that. If you're presenting with any chronic disease, we look at to see if you have like leaky gut, and we have some functional lab that we can order to see if you have that, and we need to fix the gut, and then eventually you're gonna fix your brain eventually.
Yeah, and
So,
overall health, the gut is very important. So you want to make sure you don't have too many one kind of bad bacteria, like positive aerobic bacteria in your gut. You want to make sure you have anaerobic bacteria in your gut, the good kinds that they produce hydrogen in your gut, and the hydrogen is protective. Unfortunately, as we get older, because of our diet and all that, hydrogen level in our body goes down. That's why hydrogen is becoming so popular now. People are I'm recommending patients putting hydrogen in their water and wait and then drink it, is because a lot of people have gut issue and the bacteria is not balanced. They don't have good enough anaerobic bacteria in the gut. I know a lot of people are doing probiotic, but the problem is we have trillions of bacteria in our gut. Just by taking 1 billion of one kind of bacteria, probiotic is not going to be enough. Best way to fix it is with your right diet, and make sure you get rid of you balance the bacteria by doing stool testing, and as Dr. Acevedo discussed, testing to find out your gut bacteria distribution. That's important.
right, because and the main reason for that is our food nowadays is bad. It's killing a good bacteria, and now it's contaminated with glyphosate, which is a chemical from pesticides. So we have to be very, very careful on this. We need to take care of our gut.
Yeah, and then as we discuss mental stimulation, if you're socially having at least more than 5 friends, you have much less risk of Alzheimer, dementia. So having people you hang out with, having people you play game with, not doing the same thing all the time, that's not going to be helpful. You want to engage to learning new language, like learn Italian or whatever language you have, Spanish maybe here. So whatever you start learning new thing, your brain start producing more synapses, more connection. You become sharper. So what I tell some patients, that's what I used to do, is memorize license plate. And I still try to memorize phone numbers. So it's the problem is this world that makes us lazy. Everything you type on your phone, you don't use your brain anymore as much. But it's very good to go back to old time, try to memorize phone number, try to memorize birthday date, don't use that calendar, that notebook, don't be so much dependent on it. Use your brain. You could still have a notepad on your pocket, but try to use your brain, try to remember it. That's one of the key thing is, because the more you remember stuff, trying to learn, your brain start producing synapses. And what else?
Crossword puzzle is another one.
Yeah.
Anything that makes your brain work, like anything, puzzles or anything that would stimulate brain. Another thing that I would like to point out, as far as infection and chronic inflammation that leads to Alzheimer's and chronic inflammation of the brain, they found out that Lyme's, we need to rule out Lyme's disease and co-infection of Lyme, and then mold is really important. We're seeing mold toxicity in some of our patients now.
Yeah, causes foggy brain, dementia, headaches.
Right. So those are the things that we need to rule out if you're starting to have that. And in fact, we've got Dr. Dale Bredesen, who's, I guess, the #1 guy in reversing Alzheimer's disease. Before, we used to say Alzheimer's disease, that's it. There's nothing we can do, but now they've been reversing Alzheimer's disease, and we have patients, own experience here, that some were still working on it, and I found out one patient of mine actually right now that I'm working, he has bad teeth to begin with, and he worked in the constructions. He was exposed to molds. He has mold toxicity.
Metals, probably.
Metals, because he had bad teeth, and then he had a mercury fillings there. So. And then I did provocative test. He has lead, mercury, cadmium, aluminum. So those are the things that we need to work on. And then especially mold, it takes a while and it's really complicated. It takes like 1 or 2 years to get rid of it.
Yeah.
So you have to be patient.
Mold is one of the hardest diagnoses to diagnose a patient because the symptom is so vague. They could have body ache, they could have chronic fatigue, they could have headache. But there are simple stuff to do now. Actually, as a marker, we both took a course, so we know what to look for in our patient now in terms of mold. And then stress.
Stress is another one. So here's the thing. So who doesn't have stress nowadays, right? So what we usually do is we take some adrenal stuff to supplements to modulate our cortisol. Here's the problem with the cortisol. Over time, if your cortisol is always high, it sends signal to your brain telling, okay, there's too much cortisol here. Actually, it causes problem with a memory consolidating area of brain called the hippocampus.
Yeah.
And that gets burned out as your cortisol starts to go down. So it was persistently elevated, and that could affect chronic brain inflammation.
Yeah, that's why it's important for you guys out there. At least 1 hour a day, have a relaxation time for you, whatever it means to you. For me, it's maybe an hour yoga, or take a bath, or you could go walk outside by the ocean, or sit home, meditate, or read the Bible, or prayers, whatever that gives you that peace of mind to be able to relax. Make sure you do that. That plays a key role in your anti-aging and your brain, everything.
That's a good point, because I part of my relaxation on weekend, I go to the beach. It's really relaxing for me. I can meditate, and good point of reading, scriptures. If you're a Christian, you read Bible, anything like that makes you really make it more relaxing.
Yeah, and then we did talk about nutritional deficiency, but we didn't mention, some of the testing we do, like the vitamin testing, we want to make sure your B12 is good, your folate, B12 plays a key role for our memory, omega-3 play a key role. There are other vitamins that are important. And
we do have a blood test for that.
Yeah, so we do that, make sure all those are, we don't like to randomly give people vitamins, depending on their blood test, we make sure those are fixed. And then thyroid is one of the key one. Thyroid is important. That can cause memory loss and forgetfulness, short-term memory.
Yeah, I always tell my patients, if you have one problem with your hormones, they're like a symphony. So if one is off, more than likely the other stuff will be off. So.
Yeah, and other issues, like if you have hypertension, elevated blood pressure, or high cholesterol, or high sugar, these are all risk factor for Alzheimer's. So you want to make sure your blood pressure is good, your sugar is low, your cholesterol is perfect. Also, cholesterol medication can cause dementia. They really bring your cholesterol down. You want to make sure you don't bring it too far down. You need cholesterol. 20% of your cholesterol, that food that you eat and your liver produce cholesterol, goes to your brain. So what happens when you cut that cholesterol production? You're not having anything to your brain, you're shrinking your brain. Right. So unfortunately, we are becoming really tight with the cholesterol ranges, and we are shrinking our patient's brain. And that itself causes dementia. So we want to make sure our cholesterol is not too far down. Number one killer is the inflammation is not good either. Inflammation causes all kind of chronic diseases. So what inflammation, if you have inflammation and high sugar in your blood vessel, they go and scratch your blood vessel. Then bleeding happens. Then cholesterol goes to stop it. It's a good thing, you have cholesterol to stop the bleeding, but then plaque forms. So that's why, but then they say, oh, cholesterol is the beast, but it's not really, it's the inflammation and sugar. Right. You could have cholesterol of 300, high cholesterol, but not having issue because you have low sugar and inflammation. But I'm not saying to have it, ideally is less than 200 total cholesterol, but just want to emphasize that is really the sugar and inflammation that are the most toxic to our body.
Exactly.
And
I think we pretty much covered
everything. We
covered the root causes.
So in summary, basically, number one thing is prevention. You don't want to get there. You don't want to start having memory loss, personality disorder, and different like that. These are all signs of Alzheimer. You want to be on top of it. Make sure you exercise. Make sure you sleep. Make sure you detox. Make sure you eat good, nutritious, colorful vegetable and fruits. Make sure you meditate or whatever you do, prayers, decrease stress.
Right. So even if you already have the symptoms, there is actually hope.
Absolutely.
Now, so
Yeah.
I mean, before we're like, oh, it's hopeless. Once you have Alzheimer's,
Yeah,
but
and just
actually,
patient has to realize when you have the gene, that's not your destiny.
right?
It's just your gene. I mean, I have the gene for depression and rheumatic arthritis. Does that mean I have those two? No. It's all about the lifestyle. You control your genes.
Actually, I have ApoE4, E4, 2 out of 2.
Oh, you
So
do?
increased risk of Alzheimer's. But what I'm doing right now, I'm really proactive.
So
So
that's good.
right,
Yeah,
so
nothing to be worried. You
nothing
know
to
what
be worried
to
about,
do.
right? Yeah. So again,
Anyways.
we're gonna put it out there that there is hope, and even if you already have those symptoms, you can reverse it by looking at all of the things that we mentioned, the root cause, and that's really
So,
important.
as Dr. Acevedo mentioned, conventional drugs are out there. Yes, it doesn't reverse it. It slows down. It's not a treatment, really.
Right,
It just slows down the dementia. Sometimes we need to take them. That's fine, but it's all about doing the other stuff too, so it doesn't get worse and worse.
Right.
Thank you for joining us today.
Thank you.
Bye.